Research Travel Fellowship Award, Early Career International of the Society of Biological Psychiatry. Dr. Ojeahere served as the General Secretary of Association, of Early Career Psychiatrists in Nigeria. And she is currently a Leadership Council member of Conflict Resolution and Conflict Management section of the World Psychiatric Association and a member of several local and international associations. Dr. Ojeahere volunteers and partners with faith-based organizations, civil societies, government and private establishments. Dr. Ojeahere writes on issues relating to mental health and its challenges in local magazines and newspapers. She produces mental health themed short films. She is actively involved in promoting mental health in communities and in the fight against stigma and discrimination of people suffering from forms of mental health problems and marginalized population in Nigeria. When Dr. Ojeahere is not working with populations in difficult circumstances, raising advocacies, training, or organizing community activities, she is gardening, cooking, or creating memories with her family. Dear students, welcome Dr. Margaret Ojeahere.
Thank you, Prof. Thank you. If Prof wasn't already a professor of pharmacy, I would have said she will make a good psychiatrist / psychologist. The way she took you guys down that path is quite commendable. Prof, maybe you can come and do volunteer services with us. All right, let's clap for ourselves too. We've completed one phase of our lives, right? We've written our exams and ready to go home, right? Yeah, so you indulge me a bit. How many minutes do I have? So I don't go on my tangent. Okay, 1 hour is good. I should be done before then, hopefully. All right, so thank you, Prof, for the kind introduction. I've been asked to speak to you on mental health-related issues, and the topic I'll be discussing with you, you've seen it, is stress, burnout, and its consequences, safeguarding the mental health of next-generation pharmacy students. Yeah. And so, okay. Is it that I'm not getting it right? What? Okay. So, yeah, by way of introduction, let's suffice to say that, indulge me, I don't know what it's called. What is it called? Is it pharmacy training? It's kind of interactive now. I'll speak. Prof, what is it called? It's not medical. Is it medical training too? Yeah, okay. So please indulge me. Pharmacy training can be highly stressful. I'm sure you already know that. And that, oh, you do, right? Yeah. And in the course of your training, you experience high rates of personal distress. But the interesting thing, kind of worrisome too, is that we don't seek help like we offer our patients. True or false? Yeah, we give advice, we counsel them, we prescribe, but we kind of leave our own health somewhere, right? Yeah. And so the consequences are profound. And the sad thing is that we're not having enough conversations. Okay, I don't know what you just told me, but okay. The sad thing is that we're not having enough conversations around this. And so I must commend Prof for bringing a psychiatrist. You know what? You know who a psychiatrist is, right? Who is a psychiatrist? A doctor of who? Yeah, what did you say? I kind of heard mad people. That's the mindset. A doctor of mad people. I cringe because we'll talk about that. If you must use mad, let's use it in the context of making a difference, right? Because some of those people that you call mad, they are people's siblings, people's parents, people's children, right? Yeah, people's friends. And they didn't ask to be. Somehow something went wrong. So people that have psychological problems, is that better? Yeah, it is better because I'll now ask us later on, who is really mad? Everybody, right? That's so smart. That's so smart. Whoever said it should get a first class. Automatic. You know how you go for this something got talent and they press the gold buzzer, right? That person deserves that. I press the gold buzzer for your first class. So I'm using this outline in the course of my discussion, and I'm hopeful that at the end of the conversation, we'll identify that stress and burnout is a common phenomenon. It happens to everybody, and that it has its consequences which can impact on our mental health and our physical health. And we have a responsibility, collectively and individually, to ensure that we achieve this mental health that we're talking. Now, the question might be, hey, we're talking about stress. Where is she bringing mental health? Just follow me along this path and we'll see. So some people might be wondering, why are we talking about stress here? Why are we talking about mental health? I'm fine. I'm doing good. I'm ready for the holiday. So run through this with me. Let's just quickly do it. You don't have to tell me. In the last 1 week, have you felt exhausted? Have you felt less confident? Are you overwhelmed with your responsibilities? Is there no sense? Do you feel like you're not making significant progress despite you have, okay, you're not having, you know, they're already giving me the answer. You don't have enough time to complete your task. And you feel like things are piling up. And you just feel like giving up. Okay. But I kind of heard, I like your spirit, and that's what we're talking about. They have grit. So, but I heard yes, up to 6. And then 7 showed me that you guys are like the bamboo tree. You just keep swaying. But what it tells me is also that you've been stressed in the last 1 week. And so we need to have this conversation. We need to have this conversation because can we relate with this diagram? I can. No time for yourself, unable to refuse work, long hours, too many commitments. You can't even get, meanwhile you're going to have a holiday. But this is the regular route that we pass when we are going along life. It's just so much because the world system, as it were, in this 21st century, there's so much pressure. It's almost like we're on auto drive. You just have to do it. Just have to do it. And then, so it's important that we have this conversation. But it's okay. Some people might say, Beg, just move, just do. I'm just staying here because Prof has marked my face. I don't have a problem with that. I'm just speaking to 2 main groups. People who feel that they have been stressed in the last few weeks, few months, or who at some point in time have had psychological dips, or people who want to help others that have had these experiences. So if you're not part of that group, you don't have to listen. You can just scribble on your phone or doodle. So what is stress? Let's just remind ourselves. I'll try not to make it too academic. So stress is that thing that we know, right? I don't have to describe it. I don't have to explain it. But it's a psychological phenomenon. And it also has a physical implications. And it can come from within and also from without. So from within, our thoughts, our belief pattern, and then our attitudes. And then also external losses and all that. I like how Benjamin Franklin describes it. He says that stress is often described as the 20th century. Then he was in 20th century, so I can extrapolate and say the 21st century syndrome, burnout of man's race towards modern progress, and it's ensuring complexity. So we want to be better, and somehow we are now on autopilot. So what are the causes of stress? Let's come closer home. I was hearing Prof saying you've written exams, and some people were like, and all that. And I've been there too. I don't know if it's tougher. I don't know. I can't say it is not. But one thing we know is that the academic curriculum is wide, right? Is it like wide, or you think they should add some more stuff to it? It's too wide already. Yeah. But you know, as technology evolves, now there's biotechnology, there's so many things, people are discovering stuff. There's this nanotechnology and all that. There's going to be more addition, right? Yeah. So just get ready for more vastness of the academic curriculum. And then the frequency of exams. How often do we write exams here? Every semester. That's not much. Prof, I thought it was every week. Yeah, so we write exams like frequently, right? Sometimes it's overwhelming. You are coming out of this one, and then you are entering another one. You haven't even recovered from the onslaught of that one. It's like, I don't even know anything, and they're already throwing this one at me. Does it happen? Yeah, I think it did happen, and I know it's still happening to some people I know. And then when you are struggling, when you are struggling with even comprehending something, there are some people, do you have them in your classes, when some people, they're just like, that was a breeze, and truly they will pass. You're just wondering, what is wrong with this one? Why is he not loyal, Do we have those kind of traitors in our class? So that competition is there. Then there's a fear of failure. Hey, my village already referred to me as, what do they refer to you guys as? Huh? Even doctor, they call you doctor as long as you are in the health sector and you are male. Particularly if you are male, you're a doctor. Pharmacist, and then you are saying, chai. Prof was saying that if you've written it, doesn't matter. Some people are like, kai. Some people, it is well. And then the nature of the exams. Some exams can just be toxic. I think it makes us stronger. Yeah, and then some lecturers or some lectures. That's the truth. I'm sorry. Now, maybe I'm not on the side of the lecturers. But some lecturers can be like, here and now, what is this now? Do we have a yes in the house? If they see your face, you're on your own. If they look at you, you're on your own. I will live here. You people are going to be with them. And then we don't have enough time to play. Do we really play? Any attempt, you're on your own. So what are the causes of stress? I've mentioned the academic, and then we have the psychosocial, and then we have the environmental. So we talked about the academic, which we can blame on the school, and say the school, they are the ones that are just making it tough. I don't even know safe. Even people outside the country, they don't suffer like this. My colleague outside, blah, 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 blah. But we have our own. I told you stress can be innate and external. Some people, their own stress is not the academics. It is the boyfriend-girlfriend issue that they've gotten into. True. Some people are already practicing marriage, you see? So there's a lot going on. Some people are managing the heartbreak with the everything break. So that is there. And then financial issues. And then I remember when I was, and then some people, this might look like far-fetched, kidnapping and all that. But if you remember, last year, some medical students were kidnapped, right? I remember that while they were still in bondage, in captivity, I had a number of them, their friends come meet me. And those ones were breaking down. They were not the ones involved. But the mere fact or the mere thought of their close friends being there, they couldn't decipher what was going on. It was enough for them. They stopped coming to class, even though the dean threatened and said it was going to make them repeat and all that. They just couldn't, and they were just praying for their friends. Some were praying, some were just breaking down. But that can also be a stressor. So sometimes it's not about what happens to us, what is going on with our fellow persons, right? Okay, and then there's also the environmental. Depends on how it depends. If you don't have food, if you don't have money, you cannot eat. Or you cannot eat well. If you don't eat well, you cannot read well. You will just be in that class. You can do TDB, but nothing is entering. As you are reading, it's just going. And you are seeing food. I can relate with this because sometimes I will let's not go into my story. But it does happen. And so, let's move. Then the traveling too. She mentioned traveling. Traveling is also a stressor. Not just the financial implications. Even the road is enough to make you, when you think of the road, you have this mental picture. But I think, Prof, you have very rich people here. They travel by air. Thank God for that. So how common is it? It's very common. This is just building up the case or giving you context as to why we have to have these conversations. It's very common across board, across the medical field, across any field once it concerns the health sector. But we don't have enough conversations because people see us as, we are the gods. We are demigods. We know what to do part time. But that's so wrong. In Nigeria, I remember a study by, I think it's Onlu et al. This is what she found among pharmacy students. And that was in 2020. That was peri-COVID. Now that COVID has happened, and several other things have happened, do we think it will be higher or lower? It will be higher. So I think we should do a study on that. Prof, we should do a study on that. And you know what she found out? And I tend to agree with her with what I see. Empirical evidence, is that people in lower classes. So it actually kind of broke my heart when she was mentioning or asking if 200 level or so. I'm hoping you were shy. Because I didn't see 200 level. I think it was just 300 level that raised up her hand. But that is it turns out that people in the lower classes or lower years actually have higher levels or higher rates of depression, anxiety, and stress. And that's not so difficult to reason out because you're just getting the grip of school and you're confused. You're not even sure where you are yet. But by the time you're in 400, 500, even 600, or anything that like come, whatever, was this one, we'll finish it together. We are together. So now let's talk a bit about burnout. Burnout, stress, they're kind of like, they're sisters, siblings. They work hand in hand. One is the elder sister or elder brother of one. Burnout is just an extension of stress. When you have prolonged stress, prolonged overwhelming demands, now it becomes that burnout. And when burnout, just like the name sounds, once you are burnt out, what happens? Can you be productive? When you are burnt out, you just be charged. Any small thing, you just be firing everybody. Cha, 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 cha. That's what burnout means. Just put it in simple terms. But the sad part, or the interesting part for us, is that when you are burnt out, the chances are the higher, you have a higher likelihood of coming down with emotional and psychological problems. In other words, mental health problems, even physical problems. Physical problems. You have, that's when the hormones just go crazy, cortisol, and what is it? Cortisol, right? It's all over the place, and then the diabetes is head somewhere, hypertension, cardiovascular problems are sticking their head somewhere, and then there's so much worry and all that, and then before you know it, you're not happy, and then before you know it, you have now come down to mental health issues. That's the link. So for people who are wondering, why are we talking mental health here? We're talking stress and burnout. Why is she linking mental health into this thing? Because a number of times, and we are seeing it not just in pharmacy, so there's a pathway. All the stress you've mentioned, academic stress, and then you're not getting, in your former school, in your secondary school, primary school, you've always been celebrated as most brilliant, taking all the awards and all that, or they're always clapping for you. Then you come here, and it's as if juju has caught you. You cannot remember anything. It's as if they are doing you in a local parlance. So there's reduced satisfaction. And you're asking yourself, who sent me, Seth? Who sent me? Is it by force? After all, when I even graduate, what is the guarantee, And then the burnout comes up, and then the general health is affected. And so what are the consequences? A lot. There is a fear. How many of us can relate with the fear? The fear, right? You don't have to raise up your hand. I can see, but for those that are raising up their hand, I celebrate you. Then there's the exhaustion. Then the hopelessness. Just feeling that what's tomorrow going to be like? Who sent me this message? How many of us have felt that way? Who sent me this journey now? And there's some people who their parents sent them this errand. We just harass the parent. Any small thing. After all, you're the one that sent me here. But it's a matter of time. It gets better. True or false? It gets better. It makes you... What did you say? Is it true or false? Yeah, I like that. It's actually true. It might look like there's no future in it, but just stick in there. It actually gets very, 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 very better. I used to feel like, who sent me? And then I'll go into my wardrobe and is it wardrobe? You just go into your locket somewhere and cry and ask yourself and you encourage yourself in the Lord again. And then remember all the stories of who encouraged themselves in the Lord and said, okay, I'm writing my story. And then it gets better. And then you see now, those days when I was reading without food in my belly and just feeling like an olodo. Yeah, brother, you feel like an olodo. Say, who sent me? But I don't know if you heard when Prof was saying, travel award, travel award. If I must boast, I boast on the Lord. It's not my doing. But I've traveled. I travel. Let me not say I've traveled. I travel as a result of this. So this is the outcome now. That period, I didn't see anything inside. I was just going through the motions that, okay, I will finish this thing. I will just finish this thing. Then I will drop medicine. I'll go and do something else. What is all this? But am I happy doing what I'm doing? Extremely so. Do I get to see people? I do. I travel a lot. So just hang on there. Hang in there, rather. It will get better. Can I hear yes? Can I hear an amen? It's not church, though. All right, so just don't. So when you think of dropping out, don't drop out. It might look like, even if you, see, the truth is, some people have repeated and repeated. Let me tell you something about my classmates. There was this girl, every exam we wrote, she had a receipt. She must write a receipt. The only reason why she didn't repeat is because her mother was a lecturer in, let me keep quiet because it's related to where we are. But that was the only reason why she wrote a receipt every time. But fast track, how many years after? She was the first to be a consultant. Her mother didn't help her. You know, your parents can push you to first degree. But postgraduate, you are the one that pushed yourself there, right? Her mother didn't help her. But what she had gone through made her chase or run after that. And she was the first to become a consultant. So don't look at that person who has repeated classes over and over. It doesn't matter. After a while, it balances out. It balances out. And those people that you thought, is Olodo, just wait for them. Those people are coming. There's this proverb. I'm not Yoruba, but I speak Yoruba. They say the ram that moves backwards to fight, what does it go to do? It goes to gather power. So those ones that are having repeat, when they will come, the momentum they are gaining, just wait for it. Okay, so there are several things that come, the consequences of stress and burnout. And then there's something I want to talk about, the imposter syndrome. How many of us have felt like that? Do we know the imposter syndrome? Okay. It's a very common, let me see if I think it's common, but I'll find out if it's common from you. So it's a psychological phenomenon, let's say a psychological phenomenon, mental health related phenomenon, where you doubt your achievements. They so messed you up, you begin to think that, no, it's not me that did it. When you now maybe you've been getting, I don't know, how did they grade you? How did they grade you? A, B, C, or pass, fail? Which one? A, B, C. So you've been getting C. C is like, you're neither here nor there. God is helping you. You've been getting C. Then one day you get A. Will you believe there's a mistake, right? Then you'll be praying. Every time you're in class, you'll be praying. Say, God, don't let them find out. Don't let them check remark this paper. Hey, when they say we want to remark some papers, there are some people that we thought, it is finished, How many of us feel like that sometimes? That's the imposter syndrome. When you begin to doubt your ability, your achievement, say it's not me, and then you say, very soon they'll soon say, maybe I don't even know. Maybe I don't even know how I did it. I don't even know. Even though it is there. You used to be very brilliant. You used to do this. You work hard. But you begin to doubt yourself. Are you sure it was a fluke? It just happened. God help me this time around. It was a fluke. The lecturer was sleeping. That's the imposter. You don't believe your achievement anymore. And eventually you begin to worry. You worry. You work harder because you want to prove a point. You don't even when people acknowledge it and say, you're doing so well, you've improved. You say, no, I don't know. I think it's God that helped me. Yes, there is a God factor. But you just discount. You say, I don't know what happened. I think maybe the lecturer was lenient. You just discount your abilities. And that can also lead to faulty coping mechanisms. All these things I've said, what can they do, particularly among students? It can lead to faulty coping mechanisms. People start to drink. Do we have people that drink here? Don't talk. If you talk, you're in trouble. Because I heard that there's one professor behind you who will just grab you, you're in trouble. Your mark will drop. So there's people that drink. I know that of a fact because I know medical students drink. I know regular students drink. So if pharmacy students don't drink, then we need to have a study. Something is different, But it's a faulty coping mechanism. Some people abuse substance, not just drink. Some people do all sorts of things. Some people blame others. Some people have negative cognitions. We'll talk about that, but I need to rush through this. And what can this lead to? It can lead to mental health problems. Now you might be saying, why are we having mental health? I don't have mental health. What is it called? I'm not mad. I don't have mental issues. God forbid. And they are doing God forbid in their mind. But if I tell you that, what statistics tells us is that 1 in 5 persons have a mental health problem. Do we believe that? Huh? You read it, right? But you don't really believe it. We read it. We have to reproduce it. Okay. Maybe because we think that, so let me rush you somewhere. Let me take you somewhere. Maybe because we think that mental health problems look like this. Does mental health have a particular look? Mental health issues, sorry. Usually when we think of mental illness, this is what we have in mind. Do we ever think of this kind of person as somebody with mental health problems? Do we know who she is? Chimamanda, yes, Chimamanda. Okay, it's louder here. Chimamanda. But she has come out several times to say she has depression. She breaks down from time to time. But how many of us have achieved what she has achieved? So mental health problems or mental illness is no restrictor of progress. If I can use that word. But we have a mindset. So if I now ask that question again, do we think mental health problems are more common than we know it to be? How many of us know somebody with diabetes? If you know someone that has diabetes, just raise up your hand. I'm not doing a survey. Thank you. How many of us know someone that has hypertension? Yeah. How many of us know somebody that has HIV? Rob, did you see the hands have reduced? How many of us know somebody with mental health problems? Okay. But you know what just happened, what just played out? I can assure you that a number of us know people that have mental health problems, but we are too ashamed to talk about it because of what? Stigma. Because of what society has made it to be. Say, people that have mental health, if I talk now, they'll say I have it. Or it's my sister. The other day, my sister was laughing somehow. They say, hey, no wonder. It's as if it's in the family. And they will not. So those misconceptions. And then guys cannot cry. We are familiar with that, right? Can't cry. Please cry. But don't overdo it too. If you overdo it, they will grab you and bring you to me. But I believe that men can cry. Men should cry. The lacrimal glands were made for both. There was no limitation and say, see, your own is not to cry publicly. Your own is to cry. Please cry. If you feel like, but just know that let everything be done in moderation. I can't go through this because of time. But I want us to know that who will cast the first stone? What's this? What do we think this is going on here? Alcohol problems, right? Smoking. Shopping, yeah? Well, let's say caffeine. Caffeine. What's this? A relationship, right? Then what's this? Substance, injectables, right? Gaming, yeah. What? Betting. Someone said something I don't know. She's on her phone, right? And then this is chocolate, sugar. What do you think all this? What word describes all this? Coping mechanisms. Are they good coping mechanisms? Okay, that is another one. I'm not looking at it from that angle. They are faulty coping mechanisms, but these are all forms of addiction. This is addiction. So we have alcohol. This is sex addiction. Binging on sugar. Phone addiction. So who will cast the first stone? How many of us use our phones excessively? If you use your phone, raise up your hand excessively. Okay, so, brother, do you think that mental health problem is more common than... Addiction is a mental health problem, true or false? Is phone addiction a mental health problem? Oh. Have you answered your question? So you don't have to look like the man who is disheveled and walking on the street. It can actually be anybody. Excessive use. So I'm just trying to... So when you see that person who is walking around or who has broken down, let's show empathy. Because it can happen to anybody. You know, the common slogan is, you take your hand, buy them. For those who drink, they'll say, take your hand, buy them. But is it everybody that took alcohol that breaks down? No. But unfortunately, that person broke down. Some people take up to 14 bottles. I had a patient a young person like you, he sent his wedding card to me, last week. But like 3, 4 years ago, he was suicidal. And he said he would drink up to 14 bottles a day. Because he wanted to die. He wanted his liver to pack up. But people thought he was just reckless. But there's been a turnaround. So let's be careful. Let's show empathy. The important thing to know is that 1 in 5 young persons will have a mental health problem at some point in time in their life. And the sad thing is that by the age of 14, mental illness has already shown up. People just miss it. People just miss it. So what I'm trying to say is, every adult that you see that has a mental health problem, by the time he was 14 years old, signs had already come up. Maybe he was withdrawing to self, change in sleep pattern, change in appetite pattern, preferring to be on his own or her own. What else have you noticed in your friends? Stalking girlfriends, stalking boyfriends. Do we see that here? I see it in medical students. Huh? Be moody, yeah, be moody. So some of these things would have shown up already or been unnecessarily happy. Even sleep problem is actually a mental health problem. But we need, which one did you connect with? Actually, I can't talk about the sleep, but sleep problems is actually an indication, not in all cases, so I need to be careful here. If the person used to sleep so, and then change to this, it might be a red flag, so be careful. If you are not getting enough sleep and then you are getting cranky, let me move on. But the bottom line is, as long as you have a brain, once you have a brain, you can come down mental health problem. There was this customs officer that was just crossing the road. A keke napep hit him. He fell down. He fell down, dusted himself, came up, helped the other people do whatever they were going to do. 3 days after, he started talking out of point. If they had told him 5 days before that, he will have a mental health problem, will he agree? Anything can happen. Some people just knock their feet on a stone, they fall down, they get up, and then they become confused. So what am I driving at? Let's show empathy. Because we tend to think that it is your hand. And that's our culture. It's your hand. I mean your hand like you brought it up on yourself. Our culture is we hide our head in the sand and feel that it's not there, like you assumed. We feel that I don't have to be involved. But I can tell you that we have classmates, colleagues that have mental health issues. Do we know these people? Yeah, we can relate with them, right? Do you know what they have in common? They are rich, beautiful. What else? Constant relationship. What else? They are what? They are celebrities. Beautiful. They are celebrities. They are rich. They are celebrities. They all have mental health problems. If this man comes and says he wants to marry one sister, will she wait on God? She will not wait, right? Yeah, but the thing is that they've had mental health problems. Does also stop him. What's his name again? Doesn't stop him from making blockbuster movies. Maybe this one may be controversial, but all these people, yes, they are rich. Who is this person? Those that like movies. Yeah, Ryan Reynolds. And there's so many of them. So it can happen to anybody. So now let's go to what we can do. Okay, let me talk about mental health problems very briefly. I kind of jumped. So what we see in students is that the common ones, anxiety disorder, exam, the heart is beating, that's normal. But when it's not an exam condition, you're having that heartbeat, clammy fingers, sweating, butterfly in the stomach, that's a nice way of putting it, but you're having that feeling in your tummy, you want to throw up, your legs are feeling somehow, and then you get to the exam hall, you lose everything. Some people can't even face the crowd. You say, come and do your presentation. Can't cut their tongue, confusion, local confusion. Or the lecturer asks you a question, it just jumps out of your head, you're looking at him. You know it all. It is behind somewhere, but when it's to come out, it's another thing. It's another thing. It can be an anxiety disorder, and that is very common. It does not happen to us. Yeah. Or we want to go and look at our results. We'll step there, we'll look at the result, and serious local confusion. Some people, they will be seeing another thing, or you'll be cleaning your eye. See, it's not film, or you'll be cleaning your eye like this and checking it. Am I seeing? Now, I say it's a mental health problem. They say it's a doctor, you're overdoing it. But those are, what did you say? Yeah. And then PTSD. PTSD can happen to people, anybody. I remember when I was on call. That's, you are running your night shift kind of. And then there was that bomb blast that happened, should be like 7, 8, I don't know how many years now. 2014 or so. Yeah, that's like 10 years, 11. It happened around Mr. Biggs and all that. I was on call, and some people had picked body. No, the one that happened at Jute had happened some months before, and then there was another one, and I was there. The one that they were picking body parts. Is this adult content only? 18 and above. Are you scared already? I'm allowed to talk about body parts. All right. Yeah. If you had said no, I would say the video games you play are they not more gory? Yeah. So they're picking body parts. I hadn't seen that, but I'd heard it. And they had picked hands and legs and all that, I'd heard it. And then some months after I was on call, and then there was that bomb blast and all that. I was grateful it didn't happen there. And I felt I was okay. I went home early, maybe around 11, 12. I went home. I was more like thankful that thank God, But do you know what that did to me? I couldn't enter Terminus Market for months. Because every time I'm entering Terminus Market, I just begin to have some, you know what that is called? Yeah, I had that PTSD. Is this so far-fetched? The person standing in front of you. And I'm sure a number of us have experienced something like that. Some people are more acute. Within 3 days, there was a man who, that time Fadama, I don't know if you enjoy that time, Fadama, they went to invest in one money like this, one Ponzi scam, and that was it. And the man broke down, started talking out. Respectable professionals started talking out of point because the people were waiting for him. Well, after just 3 days, he has not broken down since then. So mental illness does not have to be, once you have gotten it, you have gotten it for life, So I need us to change our mindset, okay? So it is very, very common that we think psychosis is like further down the road. Let's not waste more time. Then substance use disorder. Please, let's stop using these pills. Let's stop taking, it's a lot now, Colos and which one? Ice, right? Do we know ice? Prof, your students are very good students. If you see my students, when you see their eyes, you will know that the Colos is coloing. But this, I can see there is some evidence, element of, Then mood disorders, this is the common one. 10 to 15% of young persons, at some point, depression is more common than we think. And depression does not look like this. Sorry. We tend to think that depression is, I'm sad all the time, it's the end of the world. No. Some people work harder when they are depressed. That's how they hide it. So they are working, whether it is goal-directed, they are just working, I think there was this American comedian that committed suicide not long after they had seen him. I can't remember his name. But he was always a happy-go-lucky person. So because somebody is laughing and smiling does not mean that the person is not thinking. If you know the amount of... I had a webinar presentation for some students in a private university. And maybe there were like 40-something on the call. It was supposed to be a class. And while we were talking, I kid you not, over half of them sent messages. They want to end it. They want to end it. They want to end it. One said the only reason why she has not ended it is because her roommate is always close marking her. That once she can get herself to be alone, she will end it. And when I researched and tried to trace the reason why, they had increased the pressure academic, they had changed the setting, they had changed stuff, and so a number of them felt they couldn't continue, they were going to fail, they were going to disappoint their parents, they wanted to end it. After that call, after the webinar, I had several. So it is actually, but their mates don't know, their classmates don't know, because they come to class, they are listening, but they are thinking of the next thing to do. Please, if you ever feel overwhelmed, reach out to somebody, talk to somebody, because depression